Hello, coders. Hello, everyone. Happy Monday. Let me know if you can hear me. Let me know if you can see my screen. We will go ahead and get started with our session. All right. Awesome. Thank you so much. So, like I said, hello and most importantly, welcome to another week of our ICD10CM Guideline Mastery sessions. As always, I am Ms. Haley. I'm going to be your lead instructor for this class, and I'm always so excited to welcome everyone to our Monday night class. I also cannot believe I am saying this, but we are already on week 8, so the final week of our ICD-10 session before we start right back with our week 1. So we made it to the end of this session. Time just flew by. I would also like to introduce my wonderful team in the chat. Always so happy to have them, being so encouraging and just being overall awesome, helping you guys out if you have any questions, and already posting that survey link in the chat. So shout out to them. All right, so today we will be going over and reviewing some signs, symptoms, injuries, external causes, and encounters. So I kind of always say that, the last week is always kind of our random guidelines. So this is specifically going to be from chapter 18 through 21. I'm going to be using our ICD-10CM guideline section of the book. I'm also going to be using our MCG manual as well, so make sure to have those both handy as always. And we're going to stick with the same flow as we have been doing all these other 7 weeks. So we're going to be doing our Jeopardy game. We're going to be following that up by our in-depth Quizlet game to test our coding guideline mastery skills. And as always, I will go over the questions and show the guideline references for our warm-up, so we can use this video as well as all of the other videos we've done this session as a reference tool, so we can study as much as we need to for those coding certification exams. All right, I'm going to go ahead and read our copyright real quick so we can get into it. So ICD-10CM Copyright 2026, American Medical Association's All Rights Reserved, fee schedules, relative value units, conversion factors, and or related components are not assigned by the AMA, are not part of ICD-10CM, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained. ICD-10CM is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept FTR, Chun, AMCI Fab 7, AMCI ICD-10, Flip, Tap, and MCG are trademarks of AMCI. The credentials CBC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by the AAPC. AMCI does not own the rights to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHEMA. AMCI does not own the rights to these credentials. All right. So we are going to get right into it with our Jeopardy game. I'm going to stop sharing the screen and I'm going to go grab that. And if you are new, if this is your first time here, first of all, welcome. And this is going to be a warm-up game using all of these specific guidelines from our week 8. And you're just going to put, they're all going to be true or false, and you're just going to put your answers in the chat. Oop, I will grab that. Oh, okay. And once this loads, then we will go ahead and get started. Like I said, this is going to be from chapter 18 through 21. So our first category is going to be from chapter 18, and chapter 18. Oh, so this is going to be specifically R00 through R99, and we're also going to be doing section. So that's going to be injury, poisoning, and certain other consequences of external causes. This is going to be codes S00 through T88. It's going to be external causes of morbidity. That's going to be codes V00 through V99. And then last but not least, our third category for today's warm-up game, in contact with health services, which are going to be those Z's. Without further ado, let's start with our chapter 18 and 19. Let's start with a 100 to kind of ease us in. All right, true or false? If a patient has a burn of the same site or side, but has a different degree of burn, code to the highest degree recorded. I know that burns are going to be a lot of what we're going to be seeing, especially in this section. Very important to know how to code these. So I'll give you guys about 30, 45 seconds, and then we'll go over the answer. Okay, that is going to be time. So this statement is, where is my mouse? This statement is going to be true. We're not doing our in-depth scenarios just yet, but if I were to pick out a keyword from this section, I would pick the same site or side, because that is definitely important when you are trying to decide if this one's true or false. So yes, you're going to code to the highest degree recorded. Most importantly, if the same site or side is, the burn is on the same site or side. So great job. That was a great start. Let's keep up the energy, keep up the participation. Let's move on to chapter 20 for 200. True or false? External cause codes can never be first listed or principal diagnoses. What do we think about this statement, coders? True or false? Let me know in the chat. All right, all right. So this is going to be another true statement. No cause codes can ever be first listed or principal diagnosis. So an example of this would be, somebody spills a pot of boiling water on themselves, and in return they get a third-degree burn. So you would not code that spilling of the hot, liquid on themselves as principal diagnosis. That would be a secondary diagnosis. So this is going to be a true statement. So amazing job if you got that one right. All right, let's move on. Let's do a 400 since you guys are doing so great. From chapter 21, health status in contact with health services. True or false? Do not use a status code if a diagnosis code already includes the status information. True or false? All right. I don't know why I made this one a 400 because this just kind of makes sense. But this is going to be another. So yes, if a diagnosis code already includes the status information, you're not going to use the status code. As always, if there is a combination code that can combine the two, then you always want to use that instead of adding unnecessary extra codes. That goes kind of for a lot of, coding guidelines. So again, if you got that one right, awesome. We're going to move back to our chapter 18 and 19. We'll do a 300. As always, true or false, if multiple coma scores are captured within the first 24 hours after admission, assign only the score at the time of admission. What do we think about this one, guys? Let me know in the chat if we think this is true or false. Alrighty, that is time. So this is going to be true. I swear I'm just picking all the true ones in a row. I never do that on purpose, but it always ends up happening. So yes, so multiple coma scores within the first 24 hours, you're only going to assign the score at the time of admission. So hopefully this makes sense. If not, like I said, I will go over the exact guideline where it states this after we finish this game. All right, let's do a 400 from chapter 20. True or false? If two or more events cause separate injuries, only one external code or only one external cause code, should be assigned for the most severe cause. So again, two or more events cause separate injury. Are we using only one external cause code? Are we assigning it for the most severe cause? True or false? Let me know. All right. That one is going to be time. So this is going to be false. So if two more events cause separate injuries, an external cause code should be assigned for each cause. I know that we love a combination code if we can use it, but in this case, again, keywords I would take out of here would be two or more events causing separate injuries. So they're not going to be related. So you shouldn't combine into one external cause code. So again, that is what makes this false. So if you caught that one, nice job. Or if we learned something even better. Okay, let's do another. Let's do a 200 or let's do a 100 from chapter 21. Okay, true or false? Personal history codes indicate a past condition that's not resolved and needs monitoring. All right, what do we think about this statement about personal history codes? Let me know in the chat, coders. Okay, that is going to be time. So this is going to be a false statement. So the reason that this is false, if you go into the ICD-10 guidelines section or the MCG manual, you'll see that the correct guideline says that a personal history code indicates a past condition that's resolved but may recur and needs monitoring. So personal history codes are for conditions that are resolved. So that would make this one false. As always, if you caught that one, great job. You guys are very investigative coding today, so we love to see it. Great participation. Let's move on to a 200 from chapters 18 and 19. Again, true or false, code all superficial injuries associated with a more severe injury. True or false? Okay, that is time. So this one is going to be false. Do not code superficial injuries associated with a more severe injury. It kind of goes along the lines of when we went into our first week of coding, when there is a definitive diagnosis like pneumonia, you wouldn't also code, coughing, because that is going to be integral to the diagnosis. This is kind of the same. All superficial injuries associated with more severe injury, you're just going to include it in the severe injury, so that would make this one false. Doing great. We still got a few more to go. Let's do a 300 from chapter 20, external causes of morbidity. If the true or false, if the intent, so accident, self-harm, or assault would be examples of this. So if the intent of the injury or condition is unknown or unspecified, code as an accident. So this is going to be relating again to the external cause codes. Let me know if we think this is true or false. All right, that is going to be time. So this is going to be a true statement. So if the scenario, or if you're coding something and it does not specify if it's an accident, self-harm, or assault, and the condition, it's unknown, you're going to code it as an accident unless otherwise specified. So great job if you got that one. Like I said, I will go over where it says that specifically in our guideline books. Let's move on to a 200 from our chapter 21. True or false? Z codes are not diagnostic and should not be paired with a procedure code if a procedure is performed. So focusing on those Z codes, what do we think about this statement, coders? Let me know. All right, all right. As far as this statement goes, this is going to be false. So the reason that this one is false, it's all kinds of false. So Z codes are diagnostic and must be paired with a procedure code if a procedure is performed. So multiple statements in here are false. So that is why the answer is obviously false. So yes, if you got this one right, awesome. Hopefully this makes sense. All right, let's move on. Okay, let's do a 400 to close out our chapter 18 and 19. Okay, true or false? Signs and symptoms integral to a definitive diagnosis should always be coded. I feel like we just went over this. Okay, I'll give you guys about 30 seconds for this one and then we'll go over it. All right, it's been about 30 seconds. So yes, this one is going to be false. So I kind of gave this one away by going over the last question. I kind of used this one as an example. I forgot that this one was in here because it was in our first week. This is just a really important guideline to know. They definitely want to, drill it in. So yes, signs and symptoms integral to a definitive diagnosis should not be coded. Again, I use that pneumonia as kind of an example. You wouldn't code signs and symptoms of pneumonia and pneumonia if it's diagnosed. If it's a definitive diagnosis, you would just code that pneumonia. All right, so we closed out that. Let's close out our chapter 20, our external causes of morbidity. As always, true or false, external causes of morbidity are not diagnoses. They are codes used to describe the circumstances leading and or surrounding condition, infection, disease, or injury. So kind of a definition, true or false here. Let me know in the chat what we think. All right, this one is indeed going to be true. So yeah, so this is kind of why they're not used as primary or first listed codes, because they are used to describe circumstances leading to that condition, infection, disease, or injury. So yeah, so this one is true. Amazing job. Way to close that section out on a positive note. And since we have this good energy going, let's get our last question, and that on a positive note as well from our chapter 21. Okay, another Z code. So true or false? Z23 is the appropriate code for encounters for vaccinations and inoculations. All right, I'll give you guys a little bit of time. If we need to see what this category is, let me know in the chat. All right, and that is going to be time for our last warm-up question, and it is going to be true. So yes, this would be the appropriate code for encounters for vaccinations and inoculations. All right, so great job. Everyone did an amazing job as always. We love the participation. Love when people are putting those answers in the chat. All right, so I'm going to stop sharing my screen and then I'm going to quickly switch over to our PowerPoint so we can kind of see all of the guideline references that I used in this warm-up game. So if you had any, follow-up questions or you wanted to see what the guideline looked like specifically in the oh, okay, specifically in the book, then this would be for you. And as always, this is going to be a recorded video, so you can always look back on our YouTube page under the live section, and you can just scroll down until you find this video, and you can pause and go over this and take all the time that you need. So I'm going to quickly click through these. So this is from our chapter 18 and 19 section. So that's going to be the symptoms, signs, and abnormal findings not elsewhere classified, and our injury, poisoning, and certain other consequences of external causes. As always, this is going to be our question followed by the answer and the specific guideline number. All right, or title. This is going to be from our chapter 20, external causes of morbidity. Again, question, answer, and guideline. And then last but not least, we have our chapter 21, factors influencing health status and contact with health services. So all of those Z code guidelines. All right. So I'm going to now switch over to our Quizlet. So now we are going to move into our in-depth scenarios. As always, if this is your first time here, we're going to have 3 scenarios and we're going to break each scenario down into first our keywords that we're taking out of this scenario, next the guideline we're going to be using to help solve the scenario, and then last but not least we're going to be selecting our final ICD10CM codes. So this is going to be our first scenario. I'll read it out loud and we're going to pick out our keywords. So a 52-year-old male is brought to the emergency department by his wife after becoming extremely drowsy and confused. She reports that he accidentally took multiple extra doses of his prescribed oxycodone over the past 24 hours because he forgot he had already taken his medication. On arrival, the patient is noted to have respiratory depression and altered mental status due to opioid toxicity. He is treated with naxolone and admitted for monitoring. The provider documents accidental opioid poisoning due to medication misuse. All right, I know that is a large scenario, so we're just going to be picking out the keywords to kind of shorten this down and make it easier to digest. I'm going to try and scroll down so we can kind of see it all. So let me know what we think the keywords we're taking out of here are going to be. I'll give you guys about a minute and a half for this, and then we'll go over it. All right, it is going to be about that time. If you are still typing out those keywords, continue to do so and put them in the chat. But what I am taking from this scenario is going to be the drowsiness and the confusion, the respiratory depression, and then also the diagnosis of the accidental opioid poisoning due to medication misuse. So that kind of shortens it down because I know this one was a long one. So now we are going to take the keywords and we are going to find what specific guideline we are going to, oh, okay. We're going to pick what specific guideline is going to be reported for this encounter so that we can properly find the ICD-10CM codes. So again, I'll give you guys a little bit of time and you can either put the title or the number in the chat. Let me know what you think and then we'll go over it. And to kind of narrow it down, I totally forgot. Some of you guys don't need it though. You guys are killing it. But if you're trying to narrow it down, it is going to be in the chapter 19. I know we're looking at chapter 18 through 21. Those are a lot of guidelines, but this guideline is specifically going to be in chapter 19. So just kind of a little hint. But yeah, let me know in the chat. Okay, that is going to be time. So the guideline that we're going to be using for this scenario, again from chapter 19, is specifically going to be guideline IC19E5B, and the title of that is going to be Adverse Effects, Poisoning, and Underdosing and Toxic Effects. The occurrence of drug toxicity is classified in ICD-10 as follows: poisoning. So I'll let you guys take a little look. So yes, this is going to be the guideline we're going to be using to find those final codes. And then speaking of final codes, now we're on our third and final part of this scenario. We are going to be picking out what ICD-10CM code or codes are going to be reported for this encounter. As always, put it in the chat, and then we will go over it in our PowerPoint presentation after about a minute and a half. Good luck, everyone. right, coders, that is going to be time. If you are still working, please continue to do so. I'm going to switch over to our PowerPoint presentation so we can kind of see everything, how everything looks kind of side by side. Alrighty. Okay. Oh, and okay, so this is our scenario. I won't read the whole thing over, but again, what we're taking out of here, what I took out of here is going to be the drowsy and confused, that respiratory depression, and also the accidental opioid poisoning due to medication misuse. And then this is going to be followed by the guideline we're going to be using. So this is a snippet from the MCG manual about the adverse effects of poisoning, underdosing, and toxic effects of drug toxicity, and then specifically poisoning. So, and this is the reason why I chose the poisoning again, is because the keywords we took out and what the provider documented is the accidental opioid poisoning. So this is going to lead us to our sequencing suggestion, which is going to be right here in this right-hand column. So the first suggestion is going to be from the categories T36 through T50. So then you would just go into your ICD-10 book and then you would look for the most appropriate code. And in this case, the most appropriate code is going to be from section T40.2X, which is going to be poisoning by adverse effects of and underdosing of other opioids. This does involve a 7th character. So, and if you look up above the code, or the coding category, it says the appropriate 7th character is to be added from each category from category T40. So right that is the reason that we're going to be selecting this code as accidental, and the oxycodone is going to be an opioid. So that is again what led us to finding this specific code. So the first code is going to be T402X1, and the 7th character we're going to be picking is going to be A, because this is going to be their initial encounter. And then we're going to do our other codes. So our second, our poisoning manifestation codes. So the reason that they are being diagnosed with this poisoning is, again, if we look in our keywords, that drowsiness, confusion, that respiratory depression. So our other codes that we're going to include are going to be that drowsiness. So that is going to be code R40.0, the somnolence, which does account right here for drowsiness. And then we also are going to code for that respiratory depression. So we're going to also include this R06.89, which is going to be other abnormalities of breathing, which fits the category of that respiratory depression. And those are going to be our 2 poisoning manifestation codes. So that is why we're including those. And that is going to be our 3 codes that are going to be reported for this encounter. So if you got that one right, or if you were on the right track, or you just gave it a shot, outstanding. I hope that the explanation made sense. Let me know in the chat if it did. And we are going to, I'm going to stop sharing my screen. And we are going to move on to our second scenario of the night. And we're going to start right back from the top and be selecting our keywords that we're going to be taking out of this scenario. I will read it. So Liam, a 6-year-old boy, is brought to the emergency department after accidentally tipping over a bucket of boiling water at home. He sustained 2nd-degree partial thickness burns covering 12% of his right arm and left leg, and 3rd-degree or full thickness burns covering 15% of his chest and abdomen. The total body surface area, or TBSA, burned is documented as 27 27%. So I know there are a lot of keywords to take out of there. What do we think is going to help us pick that guideline, pick those final codes? Let me know in the chat and I'll give you guys some time. All right, so these are the keywords that I'm taking out of this scenario. They're going to be the second degree to burn. Well, the second degree burns to right arm and left leg, being 12%. The third degree burns of chest and abdomen, which is going to be 15%. And then the total body surface area being 27%. So now we are going to move on to our guideline. And I would like to say that this is going to be from chapter 19 as well, but we are specifically going to, in this scenario, we're going to specifically be focused on the burns. So I know that some people put the bucket of boiling water because that is like an external cause. That would be an external cause code. What I'm going to be focusing on, because again, I know that the burns are important. I know when I was doing my coding certification test, there were a lot of questions on burns. So I think it's a good thing to focus on. So that's what we're going to be focusing on in this scenario, because I know that burns cover, you know, a lot of codes and stuff, and we're running a little bit low on time. So focus on the burn part, not the external cause of the tipping over of the boiling water, if that makes sense. But again, doing this is going to be a guideline used from chapter 19. With all that being said, I'll still give you guys a little bit of time to find that one and put it in the chat. Let me know what we think. Okay, that is time. So the guideline that I am choosing to help find the codes for this scenario is going to be, again, from chapter 19, specifically IC19D1, which is going to be coding of burns and corrosion, specifically sequencing of burn and related condition codes. So if you got that one right, amazing job. And then now, last but not least, we are going to find what specific ICD10CM code or codes best describe this encounter. So again, I will say that I know that find that when it comes to burn degree or burn degree scenarios, that there are a lot of codes involved. And I know I'm giving you guys only about a minute and a half, and that's a lot to ask to find all of those codes. If you want to give it a shot, go ahead, or you can just type how you would specifically sequence these burns. Again, we're not focusing on the external bucket of boiling water. I'm just focusing on the burns. So if you just want to put how you would sequence the burns, you can totally do that as well instead of searching for every single code. Again, I know I'm only giving you guys a minute and a half. So either way, let me know what we think, and then I will switch it over to our PowerPoint presentation and we will go over it. All right, that is going to be time. So I'm going to switch it over again. If you're still typing out those codes or that sequencing, definitely continue to do so. I'm not going to give away our answer just yet. We have a lot to go over in this scenario. Okay, so again, here is our scenario. And what we're taking out of here is going to be that second degree burn to the right arm and left leg, making up 12%. The third degree burn of chest and abdomen, making up that 15% for a total body surface area of 27%. So this is going to be our guideline we're going to be using, our IC19D1, so the sequencing of burns and related conditions. And then right here, on the right hand column, we always have or we have a super helpful, coding sequencing suggestion. So it's saying what we should code first would be any third degree burns. What we should code second would be any second degree burns. Third, we would code any first degree burns. Fourth would be EBSA. And if you didn't know what EBSA meant, I have it right here. EBSA is the same thing as TBSA, which is going to be total body surface area. And then that's going to be followed by what we're coding fifth, which would be those external cause codes. Again, we're not going to focus on that, but the external cause code would be the tipping over of the boiling hot water. So we're just going to be focusing on the burns, and it says that we should focus on the third degree burns first as far as sequencing goes. So, and all of these are going to require a seventh character. So I just have our initial subsequent sequela. So we're going to start with our first, which is going to be third degree burn of the chest wall, which is going to be T21.31. Again, it needs a seventh character, and the seventh character for all of these are going to be A for initial encounter. So that is how we would do that. So it would be T21.31XA. And then we are going to code our other third degree burn, which is going to be the burn of the third degree of abdominal wall, which is going to be from category T21.32. Again, 7 characters. So it's going to be T21.32XA. Again, because all of these 7 characters are going to be A in this scenario because it's the initial encounter. Then we are going to move on to our second degree burns, specifically to the right arm and left leg. So that is going to be T22.291, which is going to be burn of second degree of multiple sites of right shoulder and upper limb, except wrist and hand, because it didn't specify what specific part of the arm. It just said right arm. So that's why we chose that code. Again, it needs a seventh character. That's going to be A. And then we are going to follow it with our burn of second degree of multiple sites of our left lower limb, except ankle and foot. Again, because it just says leg, it doesn't say what specific part of the leg. So that is why we're picking T24.292A. And then we are going to look down because we don't have any first degree burns. So we are going to move right on to our EBSA or TBSA, our total body surface. And we can find that by looking in our keyword selection. So that's going to be 27%. So then we're going to go back to our ICD-10 book and we are going to find the final code, which is going to be T31.21, which is going to be burns involving 20 to 29% of body surface, and specifically with 10 to 19% third degree burns, which best fits this scenario. If we wanted to do extra, I know that this is already a lot of codes, so that's why I didn't include our external cause codes, but we could, our fifth code we would code would be, again, the tipping over of the boiling water at home. But these are the burn codes we're going to be focusing on for that. So if you got that right, or you got the sequencing right, outstanding job. I know this was a long one, but again, knowing how to do these burn codes are super important. So definitely wanted to go over those when we're covering our chapter 18 through 21. All right, and then now we are going to grab our final scenario for the night. Our third and final scenario, and we are going to start as always from the top and pick out our keywords. I will read the scenario. Okay. A 42-year-old man is admitted to the hospital for treatment of a third-degree burn of the left forearm sustained 10 days ago in a workplace accident involving hot grease. During the current encounter, the provider documents that the burn wound has become infected with methicillin-susceptible Staphylococcus aureus, or MSSA. The burn is receiving wound care, debridement, and antibiotic therapy. This is the patient's initial encounter for active treatment of the infected burn. So I know that was a lot. So what keywords are we using to best describe this encounter to kind of make it more easily digestible? Let me know in the chat. I'll give you guys a little bit of time and good luck. All right, that is going to be time. So what I'm taking out of here is going to be that third degree burn of the left forearm, specifically that MSSA infection, and then also this being the patient's initial encounter for active treatment of the infected burn. So everyone was on the right track or got that right on the money in the chat. So outstanding job. Let's carry over that energy into our second part of our final scenario. Now we are going to be picking what ICD-10-CM guideline best described this encounter. Again, I think it's from chapter 19 as well. I don't know why these are all from chapter 19, but just to kind of narrow it down a little bit. So let me know what we think in the chat. All right, all right. So the guideline that we are going to be using to solve this scenario is going to be again from chapter 19. So IC19D4, and the title of this is going to be Coding of Burns and Corrosions, specifically infections of burns. So if you got that one right, great job. And we are going to use this specific guideline and the keywords that we took out, and we are now going to have our final I don't even know what I'm trying to say. Our final part of this scenario with what ICD-10-CM code or codes that are going to best describe this encounter. I'll give you guys a little time and then we will move on one final time to our PowerPoint and see how everything looks side by side. Good luck. Okay, coders, it has been a minute and a half. I'm going to switch over to our PowerPoint really quick. Definitely still continue working if you are doing that. Okay. Perfect. All right. So this is going to be our scenario. What we're taking out of here is going to be that third-degree burn of the left forearm, that MSSA infection, and then also I missed the L on initial. This is the patient's initial encounter for active treatment of the infected burn. So this is going to be what the guideline is going to look like. Whoop. This is going to be what the guideline is going to be looking like. I know it's a short one, but it definitely fits because this is going to be burning and corrosions, and this is going to be specifically infected burn. So as always, we have our sequencing suggestion. Our first is going to be from either of these categories, but they are going to be in the T region. So we're going to choose from category T22, and this is going to require a 7th character. So that is why I have this little clip it up here, and then we are going to choose our first code, and that is going to be our burn. So we have our burn of 3rd degree of the forearm, again, because that's what the keywords are telling us. And then we have to move down to a more specific code, and so we can choose T22.312, burn of 3rd degree of the left forearm, and then we are going to use A as our 7th character, again, because what we're taking out of here is that this is the patient's initial encounter for active treatment of the infected burn. So then we are going to move on to our next code, and that is going to be the type of infection. So that is going to be our second sequencing. So type of infection, and then as we see, if we look in the scenario or if we look in our keywords, that the infection is going to be that methicillin susceptible Staphylococcus aureus. Again, infection as the cause of disease classified elsewhere. So that best fits this scenario because it is the cause of the disease. It's the cause of the burn infection. So that is why we are picking this code as our second and final code of this scenario. So this was pretty short and sweet. So you pick first, you're coding either of these from these categories. That's why we picked this burn. So it really just matters what keywords you take out and what you focus on in this scenario, and that is going to help us pick these final codes. So if you got that, amazing job. I hope that the explanation made sense. And then as always, if it did not make sense, if you have any questions that did not get answered in the chat, we are going to have our survey link once again in the chat. You can click on that and you can ask any questions if you need to go more in depth on a scenario, if you just had a question, or if you just want to let us know how we did for this class or any of the other classes we had during the session. Let us know so we can make these classes better for you and for future coders. And thank you guys so much. This is going to be the end of this class, and then we start back up with our week 1. So thank you guys so much for, if you've been here the whole time or if this is your first class with us, we definitely appreciate you guys making the time on your busy Mondays to kind of go over and master these ICD10CM guidelines. Thank you as always to my wonderful team for being awesome this whole entire session and just being super encouraging and helpful. So definitely so lucky to have them. And I hope that you guys will join us for our other live classes, and we hope that you have a wonderful rest of your week. Thank you so much for joining us, and have a great Monday.
4,000 exam passers and free classes at AMCI. Learn to go straight from home or on the road at AMCI. We're on the East Coast, the West Coast, we're all around.